Welcome to Connecting Communities. I'm your host, Nancy Bacci. With me this morning is Gay Koty, School Nurse Manager for the City of Somerville's Health and Human Services Department, and Cory Mashburn, Director of the Office of Prevention, also for the City's Health and Human Services Department. Thank you both for coming on today.
Thank you very much.
Thank you for having us.
We are going to be talking about a new initiative going forward, which the community needs to receive some education around. So I really appreciate you taking the time today to come out and talk about this. So we are going to be talking about SBIRT. And I think the easiest way to start off, Gay, if you don't mind, is telling us what exactly does SBIRT stand for?
Well, SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It's a new initiative, relatively new initiative. It has been used in the state in the last couple of years through the Department of Public Health in various communities, testing out and perfecting the program itself. What it is it's initially a conversation with students regarding drug and alcohol use. And so the screening would be using a craft tool. So to be an additional screening that nurses do with students to evaluate their use of drug and alcohol and to provide them with information, factual information, should they seek that. And if by chance they should desire to be sent to treatment or referred to treatment or referred to a mental health professional or an addiction specialist, that can happen as well.
Excellent. One thing that I did want to mention we're going to talk about in a while with Cory is going to be the annual Youth Risk Behavior Survey and how the information on that really helps to inform conversations such as this. But one thing I did want to take note of when you spoke about the nurses being able to have the initial conversation. You and I had talked previously in the past about the importance of the nurses in their roles in the school and their ability to really develop relationships with the students, which make these sorts of conversations a little bit easier to have.
Absolutely. Statistically, school nurses have been identified on numerous surveys as being one person that a student feels comfortable talking about uncomfortable conversations.
Yes.
This particular screening has been voted into law, or signed into law actually by the governor on March 14th, and it mandates that school nurses take an active role in this screening. Like many of our health screenings, this is just an additional health screening. Nurses currently do BMI, vision and hearing screening, so this will just be an additional one that they will be in the forefront of managing.
Excellent. And as you had mentioned, there has been a lot of publicity regarding this. We've seen newspaper articles, and people are starting to have initial conversations about it, so I think it's very timely that we share the information with the community now. So in your position, what do you see as the benefit of bringing this sort of screening into the school system?
Well, in conjunction with Cory, the Office of Prevention, we have seen a trend in our city, and certainly not unusual to other cities and towns in Massachusetts, that there is an uptake, an increase of drug and alcohol use amongst our young adults. And so by having this conversation with students at a younger age, and we've targeted a certain age group, initially 8th grade and 10th grade, based on information that we've gathered through the Youth Risk Behavior Survey. And it's an ability to have a conversation with students regarding their use of these substances prior to the upsurgence that we're seeing in the numbers. So the advantage would be that nobody's having this conversation right now. And it's certainly a step towards prevention and increase in students' awareness of the long-term effects of using such substances on a developing brain.
Excellent, and that's a very nice segue into the Youth Risk Behavior Survey. So if you could just give a very brief overview of the Youth Risk Behavior Survey for those at home who aren't familiar with it.
Sure. The Youth Risk Behavior Survey is a survey given to middle school and high school students. And it really talks about drug use, mental health problems, physical health, and just an overall, I guess, whole child, pretty much, because we really want to know what the kids are doing in school, out of school, and it really has huge benefits for us as the Office of Prevention, but recreation, Shape Up Somerville, and many other programs within the city.
So as Gay had said, bringing this screening into the schools, what do you see as an advantage or a benefit of doing this during this time? Is unfortunately we can't seem to open the newspaper or turn on the television without hearing of some instance with a person involved with the substance abuse issues and lots of times with co-occurring mental illness as well.
Well, I think from us, on a positive note, our drug use for youth is going down, which is a good thing. But the issue is that it's still not zero. And what we've learned over the past year, we've done a strategic plan around underage drinking. And one thing that parents are telling us is that they want more information. They want new resources and strategies. And I think this is a step in that right direction. It really gives the students a outlet at the schools. As Gay said, the nurses are trusted adults at the schools. So they need to know that they can go to somebody. Also, it will give the school just to see how the drug use and percentage of kids that are using on a certain level, because we know that if a child begins drinking alcohol before the age of 15, they're 1 in 4 chance of becoming addicted. So
that's kind of a horrifying statistic, and actually, I'm sorry, could you repeat that? Because that really, I think sometimes that takes people by surprise, and there is, evidence to back this up.
Sure. If somebody under the age of 15 starts drinking, they're 1 in 4 chances of becoming addicted.
Yeah, it really is just horrifying, particularly in light of all the things that go on today. One thing that I thought was important to highlight as well, as Gay had mentioned, the role of having a trusted adult in a life, right? So we are all parents. We have children of all different ages. And it sounds like a throwaway line, but it's easy to have the easy conversations, but it's a lot more difficult to have the more difficult conversations. And those are the ones that are so critical to making certain that all the young people in our lives know that sometimes it's hard to come to a parent if there's a particular struggle, but we're a resource for them. But if they're not comfortable for whatever reason utilizing that in-home resource, there needs to be other adults in life that they can go to. And we see that often in the role of coaching, a drama instructor, things like that, if you're in a musical program. But I think the nurses, pardon me, have a unique ability, because you're coming to the nurse for, a myriad of reasons, I imagine, throughout the year. I'm thinking back when I was in school, and I found a lot of reasons to go to the nurse. A surprise test is coming up, and suddenly you have a pounding headache that needs attention. But that sense of always knowing that when you went in there, they were always really friendly. And of course, their main concern is, how are you? And sometimes that's really all it takes, is someone asking, how are you, for you to be able to feel you can kind of unload on what is actually going on in your life. So the YRBS asks the question, do you have a trusted adult in your life? And there is the ability to indicate parent or school teacher, the different roles that are filled. But it's always so encouraging to me when you dissect the results and see that the majority of young people feel that there is someone they can go to with, any of these concerns. And as we said, it's such a topical issue now, and the nurses are so strategically placed to be the recipients of that information. So having this other tool in the toolbox, as you said, if it's just part of a screening, right? So we know you're going to get your vision checked every year. It's the accepted norm. This is what happens. So if there's a way to just integrate this where it just becomes like everything else that is done, right? So if people aren't feeling the stigma necessarily, or potentially the shame of having to kind of own up to a situation that maybe they're not comfortable articulating yet.
So certainly that is the motivation for us to target one grade level.
Yes.
So it's all students in the 10th grade that we're targeting. So there will be no stigma, no Johnny Jones we're concerned about, or this child or that child. It is all 10th grade students will have an opportunity to have this conversation in a confidential setting. So this will be done privately and confidentially. There'll be no documentation of a child's health record. It's just an opportunity to have this conversation. We'll provide pamphlets and booklets, whatever the child may need. They may be placed, in the nurse's office, and kids can access them as they need, or they can throw them away as they need. We'll be providing them with a craft tool, which each student will complete. And a craft tool is simply a tool to evaluate the substance use. And on the back of that, there will be information that they can find helpful and places they can go to find information. This SBIRT screening was developed with the Department of Mental Health, the Department of Public Health, Children's Hospital, the Bureau of Substance and Alcohol, BSAS.
Substance Abuse Services.
Yes.
So many acronyms.
Yes. Oh my gosh.
We all live in that world.
So this is not like a fly-by-night kind of program. This program has been developed, and it's currently right now Northeastern University School Health Institute is in the process of training 110 communities of their teachers and principals and school nurses in what this is all about. So it's a huge initiative going on statewide, and I'm really happy that Somerville's a part of it, and that we are we actually began our planning of this program a year ago, and we have been approved through the Department of Public Health. So the process is already begun. The initiative hopefully will begin in the fall, but we need to educate a lot more folks on this before we go forward. Parents also need to know that there is an opt-out section if they don't want their child to participate. And certainly, even if the parent doesn't opt out, a child can certainly not answer any question or not participate if they choose not to. There is no one's forced into this screening. It's just another tool in our box of things to use to help kids work their way through adolescence.
Excellent. You brought up a number of interesting points. One, I think it's important to stress the institutions that are affiliated with this, so that the community and parents in particular understand, no one sat in their office and just said, here's a great way to do this. Research went into this. The associations with these institutions really do give it the weight that it deserves. And also the fact that as a community, people are willing to address this now. I think Somerville has always been very unique. I'm very proud of the fact that, we don't really hide or run from anything. If something is going on, there's always a willingness to face it, put resources behind it, find models that work for our community and really work to implement those. Now, one thing that was interesting is the 10th grade. So when you think of, 10th grade students, right? I was just at the career fair at the high school, so I had an opportunity to talk to a number of young people. And you see the 9th graders, they're coming in and everything is new, right? It really is a time of such transition. How do you fit here? Coming from your group in elementary school, perhaps some of you have gone on to different high schools, and kind of reinventing yourself almost in 9th grade. So we know 9th grade is a huge transition area, and we've seen that borne out in the YRBS data as well. But when you're coming into 10th grade, there's a sense that you're oriented and acclimated to your surroundings. So I think it's an interesting age to use to identify this movement going forward.
Absolutely, and that's based on the information provided by the YRBS. And 10th graders are a pretty stable age. By 11th grade, they have a lot more independence. They have, probably got an after-school job and a lot more opportunities to have free money that they can choose to spend however they wish. So that is what we think is probably what's happening in 11th grade. So we want to give kids that information before they're in that situation. So that is the goal. And additionally, we're looking to address this in the 8th grade as well. And that's prior to their transition into the 9th grade, which can be very traumatic for some kids. So we want to get ahead of the curve on that, on both situations, on both ages.
Excellent. Now, I know when we talk about the Youth Risk Behavior Survey, as you said, it covers a variety of topics. And one thing that is always of interest to me, and I know of both to you, is how youth use resources, right? So as adults, we're very driven with, you have a question about X, so we go online or find something and print it out, and here you are, gay, here's the information, and have at it, basically, right? And we know with young people, like you said, they have the opportunity to take the resource, read it, toss it, pass it on to a friend. Through your office, you have the 2 youth groups, SPF Junior and SPF 100, which are the middle school and the high school groups that work on underage substance use prevention, underage drinking, and those sorts of campaigns. Do you get the feedback from the young people that resource information, what format are they looking for it in, I guess is my question, because I feel like as adults, when we talk about kids, we kind of default to social media. But I feel sometimes you often see a young person like looking through a brochure or, maybe looking up a website on their own. So do you think that's an accurate statement?
Yes. Well, that's a very accurate statement because some kids, if they see a bunch of brochures and they're with their friends, they won't go after the brochure because they just, I don't want them to know that I'm looking at it.
Right, why are you picking up this
But
one
if they're
on
in
a
a
topic?
confidential area, and they can just take it, maybe put in their backpack, and learn more. We also are learning that peers learn from other peers. So this step, the SBIRT, will actually educate even the students that are not using. It's a good step for them too, because they could be told, you're doing a good job, and here's some other resources, and then they can share those resources with friends maybe that are that they think are having trouble. And like we've learned, peers listen to peers. Not that they don't want to talk to us or listen to us, but they learn from their friends.
Well, as we can all recall way back in the distant past of being a young person, as an 8th grade student or a 10th grade student, I don't know that I necessarily would have been like, oh, here's an adult that, I think unless you have the pre-existing relationships, and that's why I really stress the importance of the nurses, because for most of the students, as we know, they are visiting the nurse for various concerns throughout the year. So it's coming into what can be a familiar setting where you're already feeling comfortable with someone, and then to just introduce this, as Cory mentioned, in the confidential setting, understanding that this person is really just looking out for your best interest.
Well, the school nurse's role is just so terrific.
They're awesome, by the way,
nurses,
all of the school
thanks.
nurses.
I think so too, but I'm a little prejudiced. But my nurses, and people fail to see the significance that the school nurse is the only person in the school building, other than the principal and vice principal, that deals with every single student in the school. So by 8th grade, that nurse has already built a relationship with that student and that family. So they aren't just, a fly-by-night conversation. Right. They have been involved. And by sophomore year, hopefully, the nurses have had an opportunity to build relationships with those students as well. I wanted to segue back to something that Cory had said. My office is in the Health and Human Services Department, as the Office of Prevention is as well. And I think that working together as in this project is terrific, because Cory has resources, I have resources, I have needs, and Cory can help me provide the information I need to the students. The students that come into the nurse's office may not necessarily have a problem, but like Cory had said, the most important part is just having that conversation, reinforcing the good behaviors that the kids have. And if they have a problem that they need to work out with an adult, maybe they've been, out on a Saturday night with a friend who was drinking and didn't know how to get out of the situation, you know. The nurse can brainstorm with that student about, well, gee, how can we, help you? What kinds of things can we come up with so that you can get yourself out of that situation? So it's an opportunity to have, more positive reinforcement that, we can never get too much of that.
Right.
We can always use more. So it's just really, to me, I think the program's a win-win all the way around.
Excellent. I think too, as you were speaking, I was reflecting on interactions with nurses and realizing that young people, as you said, over the course of their time in school have really built up the relationships. As we know now, there's, increases in allergies, that, the need for EpiPens, other things that the nurses are managing on a daily basis. So I think that makes the conversation easier to start, as opposed to if you were just kind of only seeing the nurse because, you vomited in class. But, you're having more usual interactions with them about all of these other things. So it just kind of invites the reciprocity in the relationship, I think, to develop a little more fluidly. And as we know, we have a new superintendent of schools, Mary Skipper, who came on board, as well as a new director of Health and Human Services, and Doug Kress. And I think both have been really supportive in looking forward to this implementation. And, it makes it easier when everybody is working towards the same goal. So I think it really will be successful. As you said, the hope is to really share information about this. From a prevention standpoint, what do you see this as a benefit to the community in terms of potentially identifying new programming opportunities or initiatives that could come about as a result of this?
Well, I think Gay actually pointed out something great. That is, some kids maybe they don't know how to deal with their peers at parties or their parents. So the nurses could give us not specific information about specific kids, but
Right.
you know, we have a bunch of kids that are wanting this information, so we can make fact sheets. We can do a public forum on it. We can bring education to the health classes without identifying specific kids.
Right.
But we need to use our resources, and the students, if we want to help the students are one of the biggest resources that we have. But we also need to help the parents too. So I think information that we get from the kids around, you know, maybe they're not getting enough attention at home, or they don't know how to deal with things at parties. Again, we could do the same type of form or same type of fact sheet for the parents too. So both could be on the same page. Because I think if the schools, parents, and students are all on the same page, then less problems will happen.
I agree. I mean, thinking of the need for community awareness, like we said, you know, everyone is talking about issues now in a way that I think maybe didn't happen when we were younger. You know, very much it was what happened behind closed doors, and you know, you're laughing because you remember. I mean, you never brought your business into the street. You know, it was that sort of mentality. And I think now, even for people who find it difficult, I think there's such a sense of how urgent and important these conversations are, that I think parents are willing to kind of put aside some of their own uncomfortable feelings and realize, with no over-exaggeration, that this conversation could save your child's life. You know, we hear too often of the tragedies, as we well know, that happen with all of these issues circulating, and realizing you may be uncomfortable for, you know, 10 or 15 minutes while you're muddling through this with your child, but I think it also really shows your child your commitment to them. You know what I mean? It's easy to have the throwaway, I love you too, you know, as they're in and out the door. But realizing you're there for the stuff that you don't want to talk about, or you don't want to ever imagine happening, we all still need to get to the level of awareness where you can be able to articulate that in a way that invites the dialogue. But even if it doesn't invite the dialogue with you, it opens the door to continuing the conversation.
Absolutely. And I think that beginning the conversation is the most important thing we can do. As the statistics have showed us, is that it's the middle 20 students, middle 20 adults to 45 that are having the issues today. So they didn't start then. They started at a younger age. And if we can delay the start of that, then the greater the chances are that we won't be facing those statistics that the entire state is facing today, quite frankly.
Yes, as we unfortunately know, these things really do have a way of kind of snowballing, and you know, I feel like every day if you log into Facebook or something, you're seeing some other overdose, death, fatality, things that have happened. And as you said, someone is not deciding at middle age to start this. So having the opportunity for increased awareness, and I think realizing that it has to be talked about, and you can't, it's not a one-off. You can't talk about it once and check the box off and say, well, I spoke about it, so we're done here. So I think it's really important to emphasize the community aspect of this, as Cory said. So if the schools are on board, and the nurses, and the parents, and everybody, you know, is doing this, and even though we keep using the word parent, I mean, if you're 20-something-year-old, you still, you know, potentially can be living at home in this economy sometimes with your parent, who is, again, also in a position to make observations and have the conversations.
Absolutely.
So if you had to sum up SBIRT, what is the most important thing for the community who's watching this to know as they're viewing?
Okay, so SBIRT is a new initiative that we are hoping to implement in the 2016-17 school year with the support of the school department and the community. We're looking to educate the community and students about this initiative upcoming. We've spoken with some of the school administration about this, and we want people to know that we would like this to reduce our students' involvements or our young adults' involvements with alcohol and substance abuse. We don't know if this is going to be 100% effective. Statistics will show us it'll pan out as time goes on, but currently we are not doing anything like this. It's a screening tool. It's an opportunity to have a conversation. We're hoping to be able to refer students, if they need to a clinical youth specialist to broaden even more of the Health and Human Services role in the schools to help students develop positive strategies and a positive relationship with their families and their friends.
Excellent. And from a prevention viewpoint, what do you see as being the biggest benefit of this?
I think SBIRT is another tool in our toolkit as community members, schools, and parents and students. And I think this will help us decrease substance use in the city overall.
Excellent. I wanted to thank you for coming on today, but more importantly, I wanted to thank you both for showing the leadership necessary to implement something like this. As we know, this is a community-wide concern, and as I said, trend data will develop and we'll be able to create potentially programming based on the results of this, but just knowing that it's available as an option, I think, would give parents another measure of comfort as well. As we said, you know, it's not easy to talk about, but if you're able to utilize those pre-existing relationships to their fullest advantage, I think it's an amazing thing to implement. So I really appreciate the work both of you have done to bring this forward. So, and if people are looking for more information, they can follow up with either of you directly.
Sure.
At City Hall Annex, 50 Evergreen Avenue. Thank you both so much for coming on today.
Thank you,
you.
Nancy.
As always, I'd like to thank the production crew, Joe Constantine and George Wood. We'll see you next month. Thank you for watching.